It's the Best of Care Experts, the podcast that empowers you with knowledge for health and self-care.
We've had 31 conversations with 19 experts from across the country.
Basically, we've covered just about every topic you could think of.
Facial rejuvenation, LASIK, eyelid surgery, facelifts, dry eye, healthy teeth, hearing loss, and pet anxiety.
Melissa, what was the most interesting thing you learned?
Do you remember when Dr. Courtney Campbell came and told us about pet anxiety and how dogs can perceive time through smell? I could not believe that. I'd never heard of that before. What about you?
One of the most interesting things I learned was how many laser facial treatments there are. Dr. Kirby just opened my eyes to what I can do for my skin.
So, if you missed them, here are some of our most popular moments. And we'll be back in the new year with even more care experts and trending topics you've been wanting to know about. I can't wait to talk to Dr. Q.
Let's bring her in.
Let's bring her in. Let's talk about the consultation. What can a patient expect during a facelift consultation?
Well, a comprehensive analysis of your anatomy and your concerns. I will suggest what level of procedures you're going to need. Is it just a facelift, or are we going to address eyes? Sometimes people will say, oh, I'm okay with such and such, like my eyes. But if they have a lot of hooding of their eyes, I'll say, you know what, we're there. And it's not like I make analogies to cars a lot. I don't know why. But I'll say, you know, if you're going to go get your car redone, you're not going to say, well, just leave the headlights. I'll deal with those later.
Yeah.
You're going to want to clean up the headlights, you know, and you want them to work, and you want them to look bright. And
Yeah.
So sometimes I can guide them as to, this is a really good time to address this at the same time.
Exactly.
Sometimes it's unnecessary, and you say, yep, you know, or they've had their eyelids done when they were younger and they still look good. So sometimes people have had their eyelids done when they were younger and they need them done again.
Yes.
That's called a secondary upper blepharoplasty or what have you. So you know, there's that's why it's so important to go for your consultation, because we have to tailor it to you. Every individual face. Sometimes people might need a chin implant or a rhinoplasty, you know, or earlobe reductions. I mean, there's all kinds of things that we assess.
Chin implant.
And then we're going to tell you how much you can do in one surgical setting.
You must have known my next question, because I was going to say, well, what's the recovery like if you do a full facelift, like the most invasive of the procedures? How long are you looking at a recovery period?
I always tell patients a flat 2 weeks. Why?
Okay.
The first week is
not so
bruising
bad.
and swelling, right?
Mm-hmm.
Second week is going to be resolving bruising and swelling.
Yes.
If you've had a laser, your skin to re-epithelialize takes about a week, and then it could be pink. But you can hide that with makeup, okay? But I say, you know, we still use sutures in the face that we have to take out. Why? Because we definitely do sutures that are deeper, that are absorbable, but the suture material that we use in facelifting, we have to take out because it is the least reactive and they create the best scars. So we want to minimize scarring on the face.
Right, of course.
Right.
Yeah.
So I can start getting facial sutures out in about 7 to 10 days, and then maybe post-auricular sutures out anywhere from 7 to 14 days. Sometimes I'll have staples in the scalp that might come out a little later, like at 14 days. So, you know, you have to keep that in mind. So usually I'll just ask the question, okay, are you talking about you can go back to work, or, you know, if you work from home, when can I go to, you know, just do meetings? Or do you have a job where, you know, you've got to be fully recovered because you're going to start lifting things
Physical
into
labor.
physical.
Right,
you know?
right.
So then I discuss all that. So it's important to know what they do for a living, what their expectations are, how quickly they want to get back to what. Because sometimes we can even break up the lasering and the surgery, right?
Right.
So I've had patients who said, well, I don't have that kind of downtime now, but I have something coming up I'd love to look fresh for. So we might do the laser of the face and neck first, and then they'll come back for the face and neck.
You
I
can do
see.
them
You
in
could break
different
it up.
order. I didn't even,
Oh, that's cool. Okay. That's
All the
really...
things you don't consider.
I know.
We're going to talk about LASIK with a LASIK expert. Let's bring in Dr. Dean Ellis.
Yeah.
Much of what we see in ophthalmology we can treat readily with a procedure that may only take 5 minutes and can dramatically affect someone's quality of vision and their quality of life.
Yeah.
And that's just fantastic. I'll give you an example.
Please.
With the LASIK procedure, we can take someone who's been wearing glasses since they were in 2nd grade, right? They may not ever remember a time when they could see clearly without glasses. After a 10-minute procedure, they get up off the table and they can see the clock across the room for the first time in their life.
Exactly.
And sometimes they are overwhelmed with joy. They burst into tears. They give me a big hug.
I love this.
Who gets that in their job
That's
on
right.
a regular basis?
Dr. Park is a board-certified plastic surgeon. So let's bring him in. Dr. Edward Park, come join us and tell us all about eyelid surgery.
Yes.
The thing about eyelid surgery, to me, that is scary is that, I mean, it's your
eye.
eyes,
Yeah,
right?
yeah.
Right?
Yeah.
It's your
somebody's
eyes.
going in.
How do you
Yeah.
what do you say to someone who comes in for a consultation and they're interested,
Yeah.
but they're also a little like, wait a minute, Dr. Park, don't mess this up.
Yeah.
What do you
seriously.
say?
Well, I say the eyes are the windows to the soul.
Well.
So we've got to address this. It's
Right.
very important. One thing that is scary is people think that we're operating on the eye. We're not. So it's not like we're not touching the eye. Your eye does remain closed, so it's very, 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 very safe.
It's the
So
skin around the
It's
eye?
the skin and the
Okay.
fat around the eye that we're addressing. So it's all
Interesting.
above and away from the eye per se.
The eyeball.
The eyeball
Got
is
it.
Okay.
protected, and even though people say, "Oh, there's a risk of blindness," that really never ever really happens.
Okay, you never said
Right.
That already calmed me down a little
Yeah,
bit. So anybody
yeah.
listening, I hope that calmed you down as
Yeah.
well.
Yeah.
What's the timeline for that? So let's say I don't want to do a double lid surgery.
Right.
I only need the upper.
Correct.
What is that timeline? What does that process look like?
So eyes are one of my favorite because number one, it's going to brighten your look, and number two, it's probably the most quickest, easiest, and painless surgeries you'll ever go through.
Amazing.
So let's say we do a consultation, and we sign up for surgery. I usually will do upper lids, and it'll be done generally under a twilight or a local sedation. You don't even have
That
a
was my
breathing
next
tube.
question. Do you have to go
What?
under?
It's
So
very
you don't have to
easy.
go
You
under.
don't have to
No
go
general
under.
anesthesia.
That's amazing.
I remember doing my father under a local.
You did your father?
Yeah, that was pretty hairy.
Oh my
Did not want
goodness.
to mess up.
Oh, I did not. Uh-uh.
He would have had a lot to say.
Oh, unless you had a
But-
terrible relationship.
No, we had
I'm
a,
just kidding.
yeah. But I basically said, Dad, you don't need any medications. I'll just numb you up. A little painful in the numbing part, but
Yeah,
he
that's-
got through it.
He did.
But yeah, easily done under a local sedation. 30 minutes. Icy eyes for a couple days. Sutures out in 1 week. Go to a very nice dinner at Maestro's. Done.
Done
my
and
goodness.
done. Okay.
Today we are talking about pet anxiety.
Yeah, we're going to talk about that with Dr. Courtney Campbell, who is a board-certified veterinarian.
Let's do it.
Yeah.
What's the role of nutrition? I know you said exercise, but what about like diet, nutrition? How can that help?
With
to-
anxiety?
Yeah, with
Yeah.
anxiety.
Well, it's really interesting. We're starting to get more and more research about the role of the microbiome, the role
The
of
gut.
the gut,
Oh.
and its effect on anxiety.
Like
and gut health.
probiotics,
Yeah,
perhaps?
probiotics.
Okay.
In fact, they like to refer to the gut as the second brain because
I've
of the
heard that,
connection between the brain and the gut through the vagus nerve. And there's a particular bacteria called Bifidobacterium longum, and this particular bacteria was shown to decrease dogs' anxiety-related behaviors. It decreased cortisol in their saliva, which is a stress
Stress,
hormone.
yeah.
And then it also decreased their heart rates and their heart rate sort of variability, that sort of rocky road of the heart. And so now Bifidobacterium longum is actually incorporated in a lot of probiotic formulas as calming agents to help dogs get through it.
I was just going to ask, well, how would one get this into
Yes,
their
yes,
dog's diet?
Absolutely, and there's probiotics that they sell online that actually have this in it. Now,
wow.
there's also an amino acid called L-theanine. This is actually really
it's-
common in green tea, right? And
Yes.
it's
I was gonna say it's for us too.
yeah, it's an instant mood enhancement. I to be honest, I drink a lot of matcha and I drink a lot of green tea. I'm a huge fan, and so because there's a little bit of caffeine in there too. That
Yeah.
helps.
A little bit.
But we're not talking about that part. We're talking about that amino acid L-theanine,
Yeah.
which now has been isolated, and you can use that along with the thundershirt, along with the pheromones, along with the probiotics, along with the behavioral modification, and of course prescription medications. Yeah.
So I'm excited to talk to our expert, who is Dr. Precious Hwang. And she, of course, knows all about the eyes. So let's bring in Dr.
Let's
Precious
bring her
Hwang.
in.
But we're talking about dry eye today.
Yes.
For the longest, I thought that was just like an adjective, a description of like, oh, my eyes feel a little dry today.
Right. You didn't know it was like an actual
Like medical term or
yeah.
a medical diagnosis. What is dry eye, Dr. Hwang?
Right. Dry eye is a condition. It can have so many symptoms. It can be blurred vision, red, irritated eyes, gritty, sandy sensation, light sensitivity, tearing, but it's typically caused by either your eyes are not producing enough tears, or those tears produced by your eyes are evaporating sooner than they should, or a combination of everything. It's actually called a multifactorial disease.
Oh.
It is something that, in my opinion, affects all of us to some degree. It's very common with age, certain ethnicities, occupations, hobbies, things like that. It's everywhere.
So what are the over-the-counter medications that that someone could go and get if they're experiencing some dry eye symptoms?
Brands that I recommend are Sustain is a great brand. Also Refresh. Drops like Retain, TheraTears. There's a lot of good brands out in the market which are all over the counter, easily accessible. You find them everywhere. Drugstores, Costco.
Are generic brands of over-the-counter? You're already making a face. You're already making a face. Are those okay, or you think steer clear of the generic brands?
I always say spend money on your eyes.
Okay.
So I'm actually a
Sense to me.
really cheap person.
Are you?
I like to save a buck. You can ask Melissa.
There's nothing wrong with saving a little bit of money.
I stay clear of generic eye drops or even contact lens
Really?
solution. I think the end of last year, there was a big recall of generic eye drops.
Oh, no.
You do not want to ever put your eyes in harm's way, risk of blindness.
Okay,
you
say
know?
less. Say less.
No more.
It's one of those things, we use our eyes every single day. It's worthwhile spending the extra buck or two to give the best for your eyes.
Right. Talking to Dr. Scott Harris, who has practiced as a cosmetic dentist for more than 17 years. Let's get Dr. Harris in here to chat all about this.
Perfect.
Dr. Harris, I mentioned that I've had several crowns, and I know just from my own personal experience that, I mean, a crown means it's beyond the point of just being able to get a filling. But I don't actually know what a crown is. I know they're not putting a crown on my head when I leave. Nobody is going to curtsy.
This is a crown you don't want.
So what is, no, it is not a crown that you want, but sometimes it's necessary. What is a dental crown?
So when a crown is necessary, it's because the outer shell of your tooth, the enamel, is broken down to the point of where you can't do a filling to fix it. When it's a small area, you put a filling in and the outer tooth structure helps to support it and keeps things durable and strong. When the outer enamel starts to break down, sometimes you have to do a crown that is essentially replacing the outer enamel shell of your tooth. So they do grind some down around the, off the top and sides of your tooth, and then they're putting a porcelain crown or cap over the top of it, kind of like a helmet sits on a head. They bond it in place, and it's there to help prevent your tooth from cracking or breaking down to the point of not being fixable anymore.
You explained that so well.
Yeah,
I'm like, oh, now I get it.
Yes.
I never ask my dentist because I just want to get in and out.
Get,
as quickly as possible.
Don't tell me.
Don't tell me. I don't want to know the details.
Exactly.
Now I do.
Now I do.
So that everybody who's listening can know the details too.
Exactly.
That's why our expert is here.
It's helpful.
It is really helpful to be informed.
And you talked about it, I do as well. I grind my teeth. I wear a guard now at night.
Yeah.
Does that also lead to, what does that lead to? I should ask.
So you're going to get chips. The edges of your teeth are going to wear down over time, which down the road can lead to bigger problems with, the teeth breaking. With me, that was the case. I wore my teeth, but then I was grinding and clenching and ended up cracking a tooth in half. And so there's a lot that can happen when you're grinding your teeth at night. And the amount of force that you put on those teeth at night is significantly higher than what you can put on them during the day. And so a lot of that breakdown and wear does happen at night.
Ooh, and is that why you need like a dental bridge? Is that where those come in?
So a dental bridge can help to replace missing teeth. For helping to prevent wear. Night guards, you can get like a retainer or a night guard to wear at night that helps to preserve the teeth so you're not grinding them down.
Right.
But yeah, when you get in a position where you end up losing a tooth, a bridge is an option to then replace that. Yeah.
When we talk about aesthetic dermatology, we're going to have our guest on to tell us all about it
Yes,
today.
Dr. Will Kirby.
He'll answer all of our questions. Come on in here, Dr. Kirby.
The way that I explain injectables to everyone is that when they're done appropriately, nobody knows. Did you get a good night's sleep? You look well rested? Is that a new haircut? When they're done poorly, everybody knows, and they look bad.
What she have
So,
done?
So true.
What is that?
I
What is
promise
that?
there's people in your life who do injectables and you just have no idea. And you're like, I'm so
Absolutely.
jealous. They're genetically gifted. It's like, or they,
Oh, yeah.
take care of their skin that way.
Exactly.
And then the other type of injectables are fillers. So fillers, as the name suggests, volumize. And by replenishing some lost volume over time, you can impart cosmesis. People say, what exactly do you all do? And it's like, well, of course, we beautify people, but the phrase I like is cosmesis. We want to improve cosmesis, which is just overall beauty. And any stigma associated with that concept hopefully is disappearing over time, because I think we're at the point, a time in the world where it's fine to look good. It's fine to feel good. It's fine to really put yourself first in terms of your grooming habits and things like that.
Yeah, I know. I really think the stigma is going away, and people also are interested in preventative skincare, like you talked about.
That's so important these days. We call it rejuvenation.
Yeah, oh, I love that.
Oh,
That's
yeah.
But you both have great skin. I think we can all agree with that, right? Well, why don't you lock it in?
Well, but
You know-
also, why? Like I told you before, I was really taking care of my skin. I guess it was 15 years ago now, I started doing Botox. When I was 26, I was like so heavily wrinkled for someone my age because of a background in theater and very expressive personality.
That's 100% true. Absolutely.
So now I feel like my skin actually looks better than when I was 26, 27, It's not
You're
moving.
both correct, but people who have that big personality, whether it's in theater and entertainment or just they're in sales or whatever, and they have a big personality, they talk with their hands like me.
Yeah.
And obviously, I use neuromodulators. I can't move all that
Right.
much. Certainly, I'm no hypocrite.
Yeah.
But people who are going to use more facial expression are going to have more fine lines and
yeah,
wrinkles.
of course.
And how does Botox work to smooth those wrinkles?
Yeah, that's. I love this question. So Botox, people say, I would only use something natural. I would never use something like Botox. Botox is wildly natural.
Exactly.
I mean, it's a derivative of a naturally occurring, botulinum.
Exactly.
And that in itself sounds kind of scary. What it does is it simply prevents communication between the nerves and the muscles. So right now, if your brain tells your muscles to get surprised, I can't do it. Maybe you can do it. Tells your muscles to get surprised, they'll get surprised. And Botox simply prevents that communication. So even though in your mind you're telling your muscles to get surprised, you can't display that
so
emotion.
crazy.
Well, as far as vision correction is concerned, our expert today, Dr. Sheri Rowen, is going to be the perfect person to tell me what my options are. Let's see what Dr. Rowen has to say. Come
Yes.
on in here, Dr. Rowen.
And there was one other thing I wanted to add, which is,
Please.
for the women's part that I wanted to add.
women's eye health, for
Yes.
sure.
Thyroid issues.
Oh.
That affects eye health?
Thyroid can affect
As you get
your-
older, too.
Yeah, if you get
That makes
thyroid problems,
sense.
you get dry eye, and you don't even, sometimes we diagnose thyroid conditions from the dry eye.
Oh, that's
And there are medications now called Tepezza, and there's a few other things you can. So I just want to make sure, we were talking about women's eye health.
Right.
Yeah.
Okay, so, our hormone changes, our makeup. So there are different makeups that are not good for your eyes.
Uh-oh.
The lash extensions probably
Oh,
aren't
lash
so great either
extensions.
because of all the glue and
chemicals.
things can collect in the glue and collect in the lashes.
Yeah.
So we don't really love them, but I know they're a thing.
What about the lash growth serums?
Like Latisse.
Lash growth
Latisse.
serums
Yeah.
are fine.
Oh,
great.
good.
Yeah,
That's good to know.
But you don't want to get them in your eye. Now, Latisse is one that, certainly works. It can change your eye color. Like your eye color might not be the best one for Latisse. You got to
heard
find
that.
Yeah, because your eye color can change.
I use this.
What about
natural
mine? I have
again.
Yeah, the
I have
natural,
dark
yeah,
brown
different
eyes,
ones.
so-
Yours might change.
Beautiful. Don't change it.
Yeah, I wouldn't use it because of my color is more like yours.
Yeah, we're
It's
very
hazel.
similar.
I've seen hazel eyes change, but it's a great product to promote lash growth. So those are good. It can change your skin color too. It made my skin a little bit darker, so I had to stop it.
Oh my goodness.
So I have terrible lashes, unfortunately. But I have great hair, so I'm okay.
You do have great hair. I want to hear more about this connection, the correlation between overall hearing health and dementia. How do those two connect?
Well, let's find out.
I know she'll have the answer. Let's bring her in. Dr. Dana Coveney. What's the connection between dementia and hearing loss?
So we hear with the brain. We don't hear with the ears. Ears collect the sound and the brain has to process it, make sense of it, and turn it into speech. And that pathway needs exercise. So think of the ears like muscles for the brain. Keeping your ears healthy and active and your hearing active helps to keep your brain active. And they did long-term studies, 25-year studies, that showed physical changes when they did imaging of the brain, that the brain was atrophying or shrinking at a faster rate with even a mild hearing impairment.
How would you have that conversation with someone who's so resistant to getting a hearing device?
That they literally don't know what they're missing.
Yeah.
That's so true.
Hearing loss is so gradual. It declines over a very long period of time. So the way you hear has just been your normal way of hearing. A lot of people don't realize how much they're missing out on until they get it back. So I'm always saying, try it. Just try it. And then you see the differences for yourself. You don't know what you don't know.
What steps can we take at any age to protect our hearing?
Just to preserve the hearing if you're in any dangerously loud environment. That's the only preventable form of hearing loss that we have. So wearing hearing protection if you're doing any kind of lawn care, wearing hearing protection if you're at a sporting event or a live music concert or venue, even kids in the band. At school, in a small music room, should be wearing hearing protection.
Oh, interesting.
When you wear earplugs, people think, well, I can't hear anything. Well, that's simply not true. You can have conversations, you can talk normally and hear a normal volume. It just brings the overall volume level down to safer listening.
I see.
Today, we're going to talk about facial rejuvenation. So let's bring in Dr. Will Kirby.
Here we go.
So I like all the treatments we do, and sometimes, I waver and I like one more than the other. But right now, my personal favorite treatment is called Clear Plus Brilliant, or Clear and Brilliant. And the way it works is really fascinating. It punches millions of microscopic holes in your skin. And those are called MVCs, microvascular channels. But they're microscopic. They're smaller than the
Does it
human
hurt
eye.
to do that?
It's uncomfortable.
Okay.
Tolerable, but uncomfortable.
Okay.
It's simply applied to your skin, the energy-based device. It's a little bit uncomfortable, and then you leave, and you'll get a little bit of redness, a little bit of swelling. But what's really fascinating is after about 3 or 4 days, you develop a sandpaper-like texture to your skin. Don't let that scare you. Sometimes you have to look worse before you look better.
That's true.
And then it'll slowly disappear. It'll slowly dissipate. It'll slowly slough off over the next few days. And after about 7 days or 10 days, your skin will look unbelievably, I call it the S's and the T's, smooth, soft, supple.
Okay. Wow.
How often are you?
Yeah, sorry, go.
How often would you get a Clear Plus Brilliant or Clear and
You can do
Brilliant
these
treatment?
as safely as every 4 weeks. I typically get one just because of my schedule, like maybe every 12 weeks, like 3 or 4 times a year I'll get one. And they're really good for maintaining great skin. They help with texture a lot. So they'll maintain great skin and they'll improve the texture a little bit. But just like any of these treatments, they allow the other products you use to penetrate deeper.
Okay.
So you don't want to use them, you don't want to use the products immediately. You want to wait a couple days, but it will remove that upper dead stratum corneum, the outer epidermal layer of the skin, and it'll increase that surface cell turnover. So it's just a really nice way to get a more robust hue to your complexion.
We are going to be joined today by 2 doctors of chiropractic, Dr. Jane Brewer and Dr. Elizabeth Hoefer, and they're going to tell us all about how to alleviate back and neck pain through chiropractic care.
What is the role of chiropractic massage in managing pain? I have to admit that's my favorite part.
The massage part?
Who doesn't? Good. I know.
Yeah.
Well, I employ massage therapists in my office, and we offer all kinds of different massage technique. We have lymph massage, we have therapeutic, we have myofascial release, and craniosacral. So massage is an effective what am I trying to say?
That's a great compliment.
Yeah, it's a compliment. Thank you. That's a great word.
Okay.
It's a compliment to the chiropractic adjustment because your soft tissues is where the issues lie. So if we can get the structure in alignment, then the muscles have to be reminded, hey, this is where we actually want you to go. So chiropractic and massage together are an amazing marriage to help people function well.
Oh, that makes sense.
In my research, I saw that there's such a thing as a chiropractic pillow. Have you ever heard of a chiropractic pillow? And if so, what is it?
I think that's a good marketing term.
Oh.
What I tell my patients,
You're like, because you're making this face like, what?
well, it's because truly there's no magic pillow, there's no magic mattress. Every body is different. Every body in a bed with a partner is different. So we just tell people to stay neutral and stay supported.
Darn it, I just got sold an Instagram neck pillow.
Oh, and it might work for you.
Darn
That's
the
exactly.
luck.
I always tell my patients finding the right pillow for you is like finding your favorite pair of running shoes or finding your favorite pair of jeans.
Okay.
Is going to be different for everybody. You might love that.
Well, supposedly it's going to help with that neck tightness, you know,
Yeah.
so who knows?
And as long as you stay neutral while you're sleeping and you're on your back or on your side, you're going to do well. So maybe the Instagram pillow will be a hit for you, but it might not work for your husband, you know?
Right, okay, that makes sense.
Yeah.
All right.
So I feel like as we get older, I mean, full disclosure, everybody knows we're in our 40s,
Yes.
right? That's not a surprise. But there are people of all ages who suffer from some type of back pain, especially lower back pain, the older I get.
Yes.
Are there any specific exercises that we can do to help alleviate that at home before coming to you, or I guess during care as well?
I think for lower back pain, and you'll probably hear this from a lot of sources, is strengthen your core.
Yes.
And your core is more than just your abdominal muscles. The core encircles the whole lower part of your spine. We develop muscular imbalances as we have habits and jobs and things that we do repeatedly every day. And so the tendency oftentimes is to, for example, have really strong quad muscles, but really tight and weak hamstrings. That's an imbalance there, and those imbalances can lead to pain. And so I think focusing on strengthening the core muscles, that's going to give your lower back a lot more support and happiness in the future.
And stretches, like I know for my sciatica, I was doing hamstring stretches and glute stretches. Do you recommend those to your patients?
It just depends on the circumstance. And that's what's so cool about the way that we practice is that it's literally tailored to the body on the table. No one thing is going to be the same exact advice that we give the next person that comes through our door. So yes, stretching might be effective. Strengthening might be effective. Another thing that I was going to add to the low back conversation is the pelvic floor. And
I'm hearing more and more about
yeah.
that.
And just having given birth 3 times and you've had babies, the pelvic floor is an underappreciated area that needs attention. But again, it's innervated by nerves that come from the spinal cord that's housed by the vertebra. So it all comes back to structure.
I need to go to the chiropractor then.
I know. Well, they're
I'm
here
having
right
some
now.
major
Did you bring your tables? Can you make it? This one's like right after.
Right now.
Right after.
Come down. We'll walk down the street and we'll get you.
All right.
Oh, that's right. Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube.
Hey, stick around if you want to hear more about health and wellness in these episodes of Care Experts. Don't forget to like and subscribe.